BRAIN basically means knowing your legal rights and how to make sure they are respected when an intervention is offered or recommended. BRAIN is an acronym to help you remember the questions you need to be asking. B stands for benefits. What are the benefits of the intervention you are recommending? R stands for risk. What are the risks of this procedure for me and my baby? A stands for alternatives. Are there any alternatives to this? I stands for intuition or instinct. What is my gut saying about this? Does this intervention make sense to me? N means do nothing. What would happen if I decided to do nothing or just wait and see? Fundamentally, this is about your legal rights during birth, mainly the right to consent. This is often not taken as seriously as it should be in a pressurised birthing situation. Remember that you have legal rights, not your unborn baby. It's against the law to give you any medical treatment or intervention without your consent. And your consent has to be informed and has to be provided every time the intervention is performed. So just because you have consented to one vaginal examination, for example, does not mean you have consented to subsequent ones. You must be given information about any proposed procedure in advance. The information should cover any material risks, any alternative treatments which are available, and the risks of doing nothing. This should be in the form of a dialogue, not just printed material, and should take into account your personal situation, not based on generalised statistics. Unless you are in an emergency situation, you can always ask for some time to think about your options and put your brain into operation. This is where your birth team will come into their own, as you may be exhausted in the final stages of labour and will need your team to be on the front line of discussions with the doctors or midwives attending you. Next, we're going to look at what happens if things change along the way.